Here's the instructions. Do you need me? I'm listening. Okay. Good afternoon. Welcome to the Buncombe County Government Media Update. It's March 17th. First of all, I would like to introduce myself. My name is Stacy Wood. I'm the Health and Human Services Public Information Officer. Thanks to everyone who is here to help us get this information out to our community. Today we have with us some simultaneous Spanish interpretation through Sensale. And we also have American Sign Language interpreters with us today, Regina Pente and Liz Phipps. Before all of our speakers present today, I'm going to ask them to come up to the mic and say their name and spell it. We'll start with that, and after that is done, we will get started with remarks from Justice Calvin Hill, who will update us on Buncombe County Court operations. After everybody has given their summary updates, we will open it up to Q&A. Thank you.
I am Fletcher Tove, FLETCHER and the Buncombe County Public Health Emergency Preparedness Coordinator.
Dr. Jennifer Mullendore, JENNIFER. Mullendore is MULLENDORE, Buncombe County Interim Health Director.
Dr. William Hathaway, WILLIAMHATHAWAY, and I am the Chief Medical Officer for Mission Health, HCA Healthcare North Carolina Division.
My name is Calvin Hill, CALVINHILL. I'm the Chief District Court Judge for Buncombe County.
All right. And at this point, I would also like to recognize our leaders in the room with us today from the Buncombe County Board of Commissioners, and we have County Manager Avril Pender, City Manager Deborah Campbell, and Sheriff Quentin Miller with us in the room today. And at this point, we'll turn it over to you, Judge Hill, if you would like to provide updates about the court operation.
Thank you. Good afternoon. Our courts are operating consistent with the order of Chief Justice Beasley that was given just a few days ago. She gave 2 emergency directives to guide the operation of the courts. All non-essential matters that could be continued have been continued or are being continued or will be continued for at least 30 days. Cases that fall into that category are minor misdemeanor charges like misdemeanor larceny, shoplifting, trespassing, drinking on city property, those type of cases. We have been continuing most of those cases 60, 90, or 120 days. So we're going a little bit beyond the 30 days that was initially recommended because we want to try to give us some room to get on the other side or at least have a little bit better idea about how this virus is operating. Matters like probable cause hearings, bond hearings, some domestic violence matters, and juvenile matters constitutionally must be held. And so we are still doing those matters in the courts. Judges still have the ability to conduct some matters that would otherwise be continued if the judge can get those in an atmosphere that would provide for the safety of all of the participants. Consistent with the Chief Justice's order, we are not doing any jury trials. Judges can still do ex parte matters in chambers if it is appropriate. We have posted appropriate notices around the courthouse related to people who have been exposed to this COVID-19 virus, people who have traveled to areas that have been affected by the virus. So those posts have been made around the courthouse, and people appear to be complying with those. One of the biggest situations we're dealing with is Sheriff Miller spoke to me several days ago about our jail population and asked us as judges to do what we could do to try to reduce the number of people being held in our jail, to get as many people out of that jail as we possibly safely can do, and then to keep as many people out of there as we safely can do. And of course, we're trying to cooperate with the sheriff on that. We've already begun to look at cases where we believe we can safely let people back out into the community. Of course, there are some people over there who will have to remain in custody, but to the extent that we can, we are certainly trying to cooperate with the sheriff on that. And that's pretty much it for how the courts are generally operating. We're still doing all of the essential things that we constitutionally are bound to do, and working very closely with the sheriff to try to keep any problems with this virus out of the jail. Thank you.
Good afternoon. So I'm Dr. Jennifer Mullendore, Interim Health Director for Buncombe County. Sorry. I want to provide additional information about the presumptive positive case of the novel coronavirus 2019 in a person who visited Buncombe County last week. At this time, it remains the only known presumptive positive or confirmed case of COVID-19 associated with Buncombe County. The individual is a resident of New York State who visited Asheville March 10th through 13th, at which time they had symptoms of COVID-19. The individual remains cooperative with all public health requests. And we again will not share further details about the individual to protect their privacy. Our communicable disease staff have completed a thorough investigation of the movements of this individual throughout our community. Per public health process and protocol, we have contacted everyone whom our investigation identified as a close contact of the case. They have been provided guidance on what they need to do to monitor themselves for symptoms of COVID-19 and what they should do if they develop symptoms. Quarantine orders have been and are being issued for those close contacts who were identified as having medium or high risk of exposure to the case, per CDC guidance. If you have not been contacted by a Buncombe County communicable disease nurse, you are not considered a close contact of the case and do not need to take any action beyond what we are telling the general public to do. I now want to talk about the community testing sites that we have set up to start today. So to serve all members of our community, Buncombe County Health and Human Services will begin operating 2 drive-through COVID-19 testing sites today at 1 p.m. The testing sites will be located at Biltmore Church on 35 Clayton Road in Arden, and at UNC Asheville on University Heights off W.T. Weaver Boulevard. The sites will be open today from 1 p.m. until 6 p.m. Based on the availability of testing supplies, the sites will continue to operate throughout the week from 10 o'clock in the morning until 6 p.m. daily. We ask that community members be patient throughout the screening and testing process. Testing is available to all members of our community regardless of their income or ability to pay. However, it is important for people to understand testing is specifically for people who have symptoms of COVID-19. So you must have a fever combined with either a cough or shortness of breath, or if you are in contact with someone with known COVID-19 and are also having symptoms of fever, cough, or shortness of breath. Individuals being seen through the testing site will stay in their vehicles, and employees will direct them where to go and give them the necessary paperwork and direction. As we expect a large number of community members to participate in these screenings, we ask for your patience with our dedicated healthcare workers as we strive to provide this important service to our community. This is an unprecedented public health event in our community, and it will take all of us working together to stop the spread of COVID-19. Again, it is important for our community to remain calm, stay informed, and be prepared for the spread of this illness. It remains critical that everyone follow the guidance to stay home when you are sick. Continue to wash your hands frequently and cover coughs and sneezes. And again, if you are a high-risk individual, a person over the age of 65, a person with underlying health conditions or a weakened immune system, we encourage you to stay at home to decrease your chance of being exposed. I will now turn it over to Dr. Bill Hathaway.
Good afternoon. The good news for us today is that there's very little to update from a Mission Health care point of view. We continue to be ever working on our preparedness for an anticipated surge of patients, and that includes readying additional space in our facilities, staffing plans, and general preparedness across the board. We, as Dr. Mullendor alluded to, have had no additional cases identified in our facilities, but we continue to test widely. We would ask that those patients who are concerned about symptoms and are considering themselves to be in need of testing to contact their providers in advance and determine where they should be seen, and we'll triage them either to the practice or an appropriate place for testing. We would also ask that anyone who is sick and with symptoms and has a scheduled diagnostic test contact the testing facility in advance to determine what the most appropriate plan for their individual case is as they're trying to get the health care that they need. Thank you.
Good afternoon. Fletch Tove, Emergency Preparedness Coordinator. Governor Cooper and members of the State Coronavirus Task Force are holding a media briefing today at 2 p.m. At that briefing, we expect Governor Cooper to announce a new executive order in response to COVID-19 that closes restaurants, bars, and breweries statewide for dining customers, but allows them to continue takeout and delivery orders. We also expect that this executive order will include an expansion of unemployment insurance to help North Carolina workers affected by COVID-19. This order is expected to become effective at 5 p.m. today, Tuesday, March 17th, and it will apply to all of Buncombe County and all of its municipalities. Buncombe County Public Health has been communicating and collaborating all week with AIR, Asheville Independent Restaurants, Explore Asheville, the Chamber of Commerce, and the Tourism Development Authority to prepare local restaurants for this type of directive mitigating measures. I mentioned yesterday that there will be some who will be confused or frustrated by these decisions, and some decisions yet to come. And I want to reiterate that these decisions are made to safeguard the public health in our community, and especially those most at risk. This is about protecting our most vulnerable. We've been impressed by the willingness of most businesses and restaurants to take steps to help mitigate community congregation and limit exposure. We've already seen many business leaders take the proactive steps to close their establishments, and we thank them for that. One more time to clarify what the expectations are from Governor Cooper's executive order is that restaurants can still be open for delivery and takeout services, but their dine-in facilities will be closed. And this closure also applies to bars and breweries. All county law enforcement agencies are aware of this executive order and will be patrolling and responding to reports of restaurants, bars, and breweries operating dine-in facilities after 5 p.m. today, and will respond appropriately. Thank you. I believe with that, we'll open it up for questions.
And if reporters have questions, we have folks in the room who have a mic that they will be holding that you can speak into. Thank you.
I have a question for Dr. Mullendor about how many people, regarding the positive COVID case, about how many people were notified that they were high contacts that came in contact with that person?
Approximately 10.
Dr. Muller, can you just expand on quarantine orders? You said quarantine orders have been issued to those people. What does that mean?
So a quarantine order, the question was, can you expand on what a quarantine order is? So a quarantine order is a legal document that outlines what a person who was exposed to, in this case, COVID-19, who was identified as a close contact and exposed to COVID-19, what they must do. And so it outlines that they must stay at home and not attend any public activities, what their monitoring process should be, and who they should notify if they develop symptoms. And it outlines what legal remedies exist should they violate the quarantine order.
Does that apply to medium contacts as well?
Medium contacts, we are issuing those quarantine orders as well. Yeah,
So that's 10 people total?
about 10 people. Yeah.
Thank you.
Somebody want to say? The time frame, so yeah, it's 14 days following your exposure to the individual. Thank you.
We have a few questions regarding daycares. Do you feel like it's safe for daycares to remain open? And is there a certain limit that you're recommending now?
So the question had to do with what we call child care centers and the guidance around them remaining open. So there has been a lot of discussion locally, a lot of questions that have been asked of me by child care center operators after the governor issued the order to close K through 12 schools. And so what I would say about this situation is that there is still a lot we do not know about COVID-19 and the role that children play in the spread of infection. As of now, what we know is that they seem to have low or very mild symptoms, and we just don't have the evidence like we do for things like influenza, where we know that they easily spread influenza to others. That evidence doesn't exist at this time for COVID-19. And we know that child care is care for children who can't care for themselves. And we also know that in this country, 40% of children go and stay with grandparents when they are out of school. And we know that grandparents are often over age 65 or have chronic medical conditions, which puts them at high risk from COVID-19. And so the guidance from the state, which is in conjunction with the CDC, is that it is a decision of the child care operator, but the guidance has been for child care is to remain open in order to have a place for those children to be while their parents, who might be healthcare personnel who need to report to work, public health professionals who need to report to work, have a place to provide their care for their children. And the guidance I've given them is, if you have high-risk individuals who staff your childcare, maybe this is the time to send them home. And have parents who have children who are at high risk consult with their child's physician and maybe pull that child out of childcare. But I know these are very intense discussions. I've had them personally with my child's childcare. So in the end, it's a decision of the operator.
A question for Judge Hill. Can you expand a little bit on how you decide who is a candidate to be released from the local jail? How many people have you released so far, and what is the process?
I can't tell you exactly how many we've released, but I can estimate that it's somewhere between probably 30 and 50 at this time. And the people that we've been dealing with yesterday and today are people primarily with misdemeanor charges, larcenies, trespasses. Many of them were people who had missed courts and were picked up and returned to the jail. So didn't pose any real threat to the community. We thought we could safely release those. The process is their lawyers will come to the courts with some pretrial information about this person, about what their charge is, what the current bond is, some history about their appearances in court, and then we look at that and make a decision on whether we believe we can safely release them back into the community. Did I answer all parts of your question? Okay.
Hey, so a lot of our viewers have been concerned that they're tired of hearing about it. How are professionals in your position dealing with the fatigue of hearing about this day in and day out?
This is an important issue to be hearing about every day. A lot of the messaging is the same. You know, we are hearing the non-pharmaceutical intervention advice that we've been giving out for months at this point. Hand washing, basic hygiene, social distancing. The reason we reiterate that every single day is because it's so important. It's so fundamental and a simple step that everyone can do to combat the spread and limit exposure. And the ramifications of this, if people don't take appropriate action, is significant. So it's important that this message gets out every day, deep into our communities, and that it resonates with them. So we're not going to stop pushing that message as hard as we can every day to make sure it's reaching everyone.
I think that's an exceptionally insightful question, and one I appreciate Fletcher's answer. It cannot be ignored what the impact of this kind of social stress has on the individual. There's issues of isolation, there's issues of anxiety, there's issues of, the list goes on and on and on. The first thing that we encourage our patients to do is to reach out to their healthcare providers and get help if they have any real serious issues. We don't want that. And then we will be, we're hoping to push forward a social media event that involves some of our behavioral health and licensed clinical social work people to address that exact issue so the community can come together and share some of those anxieties. That's often a way that we can appreciate how to handle that better. So that will be forthcoming, and I don't want to put a timeline on it, but it's been raised at the health system, and we recognize the need for that.
Another question, I don't know if this is for you, Fletch. There's growing concern about the economic fallout from the COVID-19 virus. Is there anybody today to talk about how small business owners can seek remedy or help, or can you address that? Or can you point people in the right direction as they continue to have concerns about the economic fallout?
Yes, so we're continuing to talk about, secondary impacts of COVID-19 on our local economy. So we're hoping today, Governor Cooper, as part of his press appearance, is going to address some revisions to unemployment law. I know locally we're compiling some resources that, as we meet with area independent restaurants and the Chamber of Commerce, we're pushing out to them. So as they face these decisions, we have those resources through our economic services, through our small business administration, and we're compiling those and pushing those out through our emergency operations center. So again, we're acutely aware of how these effects cascade throughout the local economy and the local community, and we're working hard to provide those resources. And we're looking for some leadership from Governor Cooper this afternoon in regards to that.
And we've been asked to provide additional information from Judge Hill on evictions.
The answer to that, as of right now, is we are not processing any eviction matters. Our situation in the courts, just like everywhere else, is changing literally minute to minute. So on yesterday when we got to work, there were a few eviction cases that were already in the pipeline. Those cases will probably be processed. But as of about 4 o'clock yesterday, we are not processing any eviction matters. Those did not fall into the category of cases that were essential for us to process. So at this time, we are not processing eviction cases.
And at this point, we're going to open the questions up to callers who are dialing in, and Zoe Mpofu will be managing that process for us.
It's not listed for Buncombe County. In a press conference, a press release you guys put out said that person is isolating in Macon County, and they don't have a positive either. So who is that counting for?
So the question had to do with why is the case that we've been talking about, the presumptive positive case, not showing up on the state website as under either Buncombe County or Macon County. So how public health cases are identified is by the county of residence. This individual is a resident of New York State. Therefore, she does not count as a case in North Carolina.
Okay, if there are no more questions on the line, we will end this media briefing. I want to say thank you to the members of the media who are bearing with us as we adapt to these changing precautions and recommendations that are coming down to us rapidly. So thank you for your partnership and for hanging in there with us.